So today's episode, we're going to be taking a look at the importance of looking at infection prevention control in terms of saving lives. Um, so for some people, they may approach it that way, and that's the way you should. But the impact that you're having day to day is that you're potentially saving lives every day. But for others, it may not be the mindset that they currently have when they're approaching their healthcare work. So important to treat every shift like lives depend on it, because they really do. Uh, Everything you do through your shift for infection control, because of the vulnerable residents and patients, you're saving lives without a doubt. Um, and you need to kind of change that mindset, how you approach your work, whether you're working in an acute care environment, whether you're working in long-term care, community care, primary care. So everything you do for infection prevention control is making a difference. So today's episode is going to focus on just trying to get that message uh, clear to everyone. For anybody that's working in healthcare. So that's where we're going to focus on that mind shift. Um, and um, you see the difference. So really kind of need to look at it, in a real way, what the impact is for infection prevention control on a day-to-day basis working in healthcare. So what you're going to see is when you apply the IPAC measures, you're going to see fewer infections. We all know that's possible. If you don't have those gaps in infection prevention control, you're going to have fewer infections. When you have fewer infections, you're going to have fewer complications. You're going to have fewer hospitalizations. You're going to have fewer residents going into the hospital, for example, and you're going to have fewer deaths. So that's the sequence, that positive sequence that you're going to see by uh, on applying your IPAC measures day to day, and um, by doing that, you're going to be saving lives without a doubt. But it's also great, not like you're saving lives, but also that you're not putting, for example, residents under unnecessary risk and the results of them getting infection and hospitalization. So everything we do on a day-to-day basis makes a difference in terms of the spread of infection. So important that we take it from this perspective. I guess the best way to put it, and look at it less in terms of a policy. Well, we always have those policies to help guide us, but don't just focus on the policy and not just focus on checklists or just audits. Focusing, you will do all those things, pieces of those, but you want to focus. I think the true impact and what changes the culture most, if you focus on or taking it like a life-saving lens, how you approach everything. I think it creates that culture. It creates more meaning into why you do these, implement and apply these infection prevention control measures every day. And with that additional meaning for the healthcare staff, I think you're going to see a lot more people applying the IPAC measures throughout their day, and even more so when they're in an outbreak, for example. So, um, I think, uh, you know, IPAC is sometimes may not be considered or looked at uh, like as a type of care. But it it really is in a sense that you're applying these things when you're uh, doing a variety of procedures, just before you provide care, before you enter. But it is all part of protecting, part of the prevention process, and you're protecting the most vulnerable people, right? For example, the residents and healthcare staff. anybody working in healthcare staff. So patients, for example. So um, one of the things that you know, sometimes it's hard to and I said before that the infection prevention control part sometimes is it like it's an invisible impact, right? So uh, IPAC doesn't always get the recognition that it does in terms of the impact that it has on healthcare, and that's unfortunate. But you can kind of understand why that occurs because everything that does is not easily visible. Um, so it, uh, that so it's behind the scenes, so that you're saving those lives, but um, it's not it's not easily to pinpoint it, I guess, on a day-to-day basis. Uh, how much you've done to protect the vulnerable residents, uh, and the patients, as well as your work colleagues. So get this episode divided up in a variety of segments. And the next segment is focusing, why this message matters right now. So, the risk is there constantly in healthcare, right? So whether it's acute care or long-term care, you have that close contact. The spaces are being shared. There's movement, gatherings throughout. Like for example, in long-term care, for example, um, and there's a lot of activity on the go. I mentioned the share spaces and everything. So what happens is often in a shift. Um, is that teams are often rushed or tired, uh, and the first things that kind of that fall off is those is those basic IPAC measures like hand hygiene, for example. So one of the first things you see is that when those things during an outbreak, things are busier. When there is say an influx of new residents, for example, or the volume of residents admitted to a floor or increase. That's a lot of extra work in many different areas. And sometimes one of the things that can occur is that the hand hygiene part of it slips away slowly, bit by bit. The PPE sequencing is not done correctly, or PPE is not done at all, and healthcare staff are going into patients' residence rooms without donning and donning their PPE and doffing when they come out. The cleaning and disinfecting steps are missed. Precautions are not put in place quick enough for patients and for residents, for example. So this is what happens, when things get busy and get hectic, or on a either acute care hospital or in a long-term care. And I think what happens is during those times, um, IPAC can feel like can feel like a burden. Like it feels like, one more thing that I need to do. That's going to slow me down. It's going to result in me taking longer to do my work. Um, and you're very busy, so that's what happens into the terms of thinking about it. The mindset changes, and our IPAC can kind of go to the background and and you forget about the meaning and the importance behind those IPAC measures and why you're doing it. So that's why I think it's we need to change the mindset of it, and you know focus more on what their outcome, how it can impact the outcome. So, like I mentioned earlier, you can have fewer infections, which results in fewer complications, fewer hospitalizations. fewer deaths. So I think it's important to kind of change that mindset and focusing on the life and taking a life savings lens, I guess. And now you kind of actually have an impact on saving lives on a day-to-day basis. So yes, it's hard to measure. It is, but it is there. You will have a difference. If you prevent those infections from spreading within our hospital environment, and do the same within a long-term care environment, those fewer infections are going to result in outbreaks not occurring, and there's going to be fewer deaths linked to those outbreaks. So it will make a difference. Um, like I said, it's hard to document it and see that because people are not getting infected, and they're not going to pass away due to that outbreak occurring, for example, or for that infectious disease transmission from occurring. So uh, it's there. We just have to remind ourselves and build that that culture. As I've mentioned in the previous episodes, the importance of that culture and building it. This is part of it, and changing that mindset and looking at it that when you approach your shift, you know, how you can make a difference by applying all the IPAC measures and saving lives. So this is why I think it's you know you know why it's so important for that perspective. And you need to kind of get it down to, I guess, practical terms. Uh, how IPAC saved lives. So and part of the role of someone working in infection prevention control is your job is to actually connect those dots for people so that they actually see the difference that they're making on a day-to-day basis in terms of saving lives. So part of your job as working in infection prevention control is to connect those dots for people and to remind them of where they're working. And I've mentioned in the previous episode, I've always explained to people, you've chosen to work in healthcare for a variety of reasons. But when you made that decision to do so, you're providing healthcare to the most vulnerable, and they're so dependent on you to protect them because they are vulnerable for a variety of reasons. So it's your responsibility to protect them, and by applying those IPAC measures, you will protect them, and you will save many lives in doing so. So that's the mindset I really trying to get. Um, I guess make it clear during this episode to take that. And I think when you do that, you're going to see a lot more meaning from the work that you do. Yes, it's like anything. Applying the IPAC measures is going to add more work to you on a day-to-day basis, but there's great benefits from it. You're going to save lives because of it. So it's like any kind of work, more documentation, increased regulations, increased oversight, everything that's put in place to protect vulnerable residents and patients are all additional things that increase the workload. And IPAC is no different, but they're all being put in for the right reasons, that we're trying to protect the vulnerable residents and patients and save their lives. So, um, you know, by applying these IPAC measures, you're going to have, like I mentioned earlier, get fewer infections. You're going to have fewer transfers, for example, from long-term care to an hospital, and you're definitely going to have fewer deaths, right? Uh, and there's additional layers of risks once you're admitted to an hospital, for example. So you may go in with one thing, but you may pick up something, or something else might be transmitted to you while you're in the hospital. So it's best not to go uh, to some of these steps. And one of them is, break that chain infection so that you have fewer infections occurring. It doesn't result in those transfers. It doesn't expose people to unnecessary risks within an acute care environment, and there's fewer deaths as a result. So So, give yourself that life-saving lens that you can apply every shift. It's not complicated in terms of that perspective. You're just showing and understanding the meaning as you approach each shift, right? You want to provide the best quality care to everyone that you're taking care of, and part of that involves applying the infection prevention control measures. And by doing that, you're going to be saving lives without a doubt. Doing so. So let's approach it from, but IPAC isn't just about but just about compliance. Uh, you want to make it show that meaning that it can have. That part of its professional, I guess, identity for IPAC or infection prevention control is that you're saving lives on a day-to-day basis. So really want to spend this episode, you know, putting that perspective and repeating it a number of times. And this is messaging that can be given to all healthcare staff that listens to this episode, or to infection prevention control managers, directors, leads, that they can use to talk to their staff about the importance of why we put these IPAC measures in place. So, um, this next segment, gonna talk a little bit about that core principle. That you're managing. IPAC's all about managing risk in real time, right? So there's so much happening each of those healthcare environments. Infections are not just random occurring. It doesn't work like that. Transmissions are following predictable patterns. There's contact patterns. There could be airborne risks. There's contaminated environment. There's contaminated environments within this healthcare setting. So there's a variety of, I guess, pathways that can lead to an infection, right? Um, and what you're trying to do in trying to break that chain of infection is you're trying to interrupt that chain of infections. You're trying to interrupt those pathways. And I guess one way to look at it is you want to think of a IPAC as layered protection. So all those small actions that you do throughout your shift, will all add up, I guess is the best way to say it, into a lot bigger outcomes. So you're going to be, let's say, you're taking care of a few patients or a few residents. Everything you do, all those little steps of donning and doffing, wiping down the lifts after you've used it, housekeeping stuff, disinfecting the room, disinfecting the railing, all those little pieces make a big difference. So they all are layered protection within those healthcare settings, and those small actions can combine or compound into making a bigger difference in outcomes, which is like saving lives, fewer infections, fewer outbreaks, fewer hospitalizations if they're coming from like a community setting or long-term care setting. So all those things make a difference. They may not seem that meaningful at the time, but they have a layered protection, and they will make a big difference. And you need to keep your perspective on that you're saving lives by doing all these infection prevention control measures throughout your shift. So, I think one of the things is that you try to think about it as, I guess, trying to normalize it in a way. You're not doing this to follow just a rule. I'm doing this to break transmission. So it's important to kind of think about that you're not just doing these IPAC measures just to follow a specific rule, for example. You're doing it all to break the transmissions, which will have fewer infections, as I mentioned, hospitalizations, fewer deaths. So And that's what we're trying to do. Do everything we can throughout our shift to protect the vulnerable residents and patients. So, and then every time you that uh, break that transmission, that chain of infection, if that's one more person that doesn't get sick, and then they don't spread it to others, and you don't have that domino effect of residents infecting one another, or patients infecting one another, or affecting staff, and you don't have that outbreak. When during an outbreak comes even more risk for a possible death to occur. So there's a lot to think about, but we want to think about it in the right perspective, I guess. Uh, and it's sometimes it can be hard to feel the success, because it's like you're preventing an event from occurring, so it's never going to be recorded, right? Uh, you're never going to know how all those IPAC measures resulted in preventing so many outbreaks throughout the year, or throughout, on a monthly basis. So, or how many infections you prevented. Unfortunately, what you see in infection prevention control all the time is you see the misses, I guess is the best way to put it. You see the gaps, you see things when things did not work. And that gets all recorded. It gets reported in the media, gets signed. You get inspections by Ministry of Labor, you get inspections by Ministries of Health and Long-Term Care, you name it. All those infections occur, and they all document those breaches, right? Which you definitely don't want it to occurring. But what's not ever getting recorded is all those infections that you did, that you were successful in preventing, all those outbreaks that you were successful in preventing, all those lives that you saved. All that doesn't get documented. That's not, because it will remain unknown. So you're not gonna. It's harder to document that. But there is still ways to do it. Because you can still collect that data, and reduce your monthly infections rates, and then you can start. There is data that you can collect, and see that the number of outbreaks like you usually see, annually going down, and seeing that your monthly infections are going down and stuff like that. So there are still ways of kind of seeing the positive impact of all the IPAC measures you put in place. It's just that you will not get to where you can say that, you prevented so many infections per month per se, right? So, um, but you should see your averages going down, and that's another indicator that you get from your data that what you're doing is having an impact. So, um, I think it's like I said, I mentioned that you're going to have fewer outbreaks. You're going to have fewer staff. Your staff, when you apply the measures, fewer staff calling in sick, because they didn't get exposed at work. You'll have fewer hospital transfers from long-term care to an hospital, and you will have the fewer severe outcomes. So you will see those results, but it's you got to put in some time and effort to document it, and make sure you have all those so you can compare annually and see that things are coming down, and share that information with your staff so that they can see some positive impact from all the hard work that they're doing right on a day-to-day basis. So it's important to remind them and to show them when you have an opportunity with the data to show them the impact that they're having. Because unfortunately, sometimes we don't. Um, infection control is like nothing else in other areas. We tend to focus more on the negative, and not on the positive things. So that's come from all the IPAC measures that we've put in place. So we've got to do part of the job for infection prevention control is to, is to highlight those differences that they're having and, help build that culture so that they see on a day-to-day basis that they're saving lives, that they're truly having an impact, right? So it's so important that they see that. So just to quickly in the next segment here, I just wanted to talk about that, we need to remind the staff, uh, you know, I guess in a more specific way, uh, who who are who are we protecting? So who are they protecting, right? And so, in acute care, there's immunocompromised patients, there's surgical patients, people with lines, wounds, get devices implanted, NICU, with pediatrics, oncology, on dialysis, you know, patients where infections if they get an infection, it can result in, turn things can turn really bad fast. So that's why, these are within an acute care environment, for example, who we're protecting, right? They're to use the word vulnerable, may kind of, you know, maybe that doesn't give enough meaning sometimes, but really you're protecting the most vulnerable patients in these examples. And I list off a number of patients coming in for a number of different things and why they're immunocompromised. In long-term care, you're dealing with older adults that are very frail. They have chronic conditions, limited reserves, I guess, dementia, they're at higher risk of aspiration. They have respiratory complications. They have a number of comorbidities. Again, all these things make them vulnerable, right? And these are the patients that we're and residents that we're protecting on a daily basis. We need to do everything we can to protect them so that these infections don't occur. And they don't become symptomatic. They don't end up in a hospital if they're in long-term care, and outbreaks don't occur. And there results in a lower number of deaths. So these are the vulnerable people that we're protecting. So and don't want to forget about your coworkers, right? So we also, we need our healthcare staff to be working, obviously, to take care of the patients and the residents. So we're also protecting our staff and preventing those workplace acquired infections, right? As well as when you do that, protecting your staff, you're protecting their families as well, right? So fewer of their families get sick, fewer kids get sick. The parents' responsibilities of staying home to take care of their kids gets reduced because they're able to go to school, they're not sick. You reduce the burnout as well from like being in a constant outbreak cycle. So because when you're in outbreak, increases the workload. So it's important to not forget about the staffing component as well, right? And then there's a number of things that you're doing to protect the healthcare system, right? So there's fewer bed closures during when you're um, applying all the IPAC measures, and there's no outbreaks. You have fewer staffing crises occurring. There's fewer emergency transfers occurring. So when you're protecting the system uh, applying all the IPAC measures, you have a more stable healthcare system, and whether that's within an acute care environment or a long-term care environment or within a community setting for primary care or any you know outpatient services or inpatient services. So when you have a more stable healthcare system, things run a lot better. People are being protected, which results in some of those negative consequences that I talked about. Right, fewer people getting sick, fewer infectious disease transmissions, stuff like that. So there's a lot to it. It is complicated, but it all goes back to saving lives. In this later part, what I talk about, protecting the healthcare system. But let's not lose sight of the fact that we're working within the healthcare system. We want to protect those most vulnerable. And by doing that, you can really have an impact day to day by saving lives. That's the bottom outcome of it. And if you think about it that way and change your mindset, you approach the work in a very different way than just focusing on compliance and being maybe someone seeing you from infection control or someone from the leadership team pointing out that you haven't done your hand hygiene or done it off properly and stuff like that. So that's all going to occur. But take it back to the point where, why you're doing all these things before you start your shift, right? You're doing all these things to protect the most vulnerable and save lives. And I think if you do that, even though IPAC, like anything else, adds additional work, you'll see more meaning to your day-to-day work and why you're doing all of these things, right? So you'll see that you're protecting people, protecting the residents, protecting the patients. Um, IPAC is, it's all about residents' safety. It's all about patient safety and worker safety, all in one. It's all combined. I was to make one kind of key statement is that IPAC is about resident safety, patient safety, workplace safety, all together occurring, and that's the difference that you can make on a day-to-day basis. So it's going to move on to the next thing, next segment. It is a chain reaction. So, and by that means like, I want to kind of go through all a small lap can become a big result in a bigger outcome. So, transmission, starts with something small. It could be a missed an ID moment. Gloves being used as a substitute for hand sanitizer for your hands. You're rushing to remove the PPE. A shared piece of equipment isn't fully disaffected. So then you see what happens with all those little small things is there's a chain reaction resulting from all that. We go quickly through this, and the person A, whether in long-term care or acute care, becomes symptomatic at first. They're interacting with people, right, and they're at the dining table or social events, for example, in long-term care. They expose other, or within acute care environment, they expose other residents, and patients and staff and visitors. So through that interaction. And then suddenly, you've gone from one infection to two infections and et cetera. And then you've got yourself in an outbreak situation. So the point to make with this segment is that all those small little things, all those little lapses add up and can result in a big outcome, which could actually result in a patient death or the resident death. So even though that's why you have to think about it, all those little things are going to compound and add up to have a big impact potentially. So, and by doing all those things properly, so by not missing your hand hygiene, doing proper doffing, donning and doffing, wearing your mask, all those things throughout the day, all those things can result in and making a difference in terms of a bigger outcome by not having that transmission occur, not having that hospitalization occur, not having that death link, that outbreak occurring, and not having a death occurring. So That's why, this segment here, I want to talk about all those little things and how they can work, up to making a big difference, right? So, you know, then you get the outcomes, right? So, um, we talked about, all those little transmissions, that can lead up to an outbreak, but, as mentioned, you're going to have fewer complications. Um, if with all those gaps, if you have all those gaps, I should say, what can happen is you could have, a number of different complications occurring. You can have an increase in falls due to weakness, due to being infectious, and symptomatic. Dehydration. You can have secondary infections that occurred, and I already mentioned like hospitalizations and sometimes death. So, and then the chain reaction is through this operational impact that I talked about a bit. Staffing illness occurring, staff shortages occurring, bed closures, morale dropping, families losing confidence in the healthcare system, whether that's a acute care hospital or a long-term care environment. So all those things have an impact from an operational side, right? So this is what I want to talk on this segment is the point the point that emphasized to just finish up this segment is it really does have a like a domino effect, right? So each little thing you do, um, you know, uh, rem- removes, so as IPAC measures, removes those dominoes, right? So if you think about that transmission of infection, um, and things that lead to an outbreak and what can lead to an hospitalization or to a death, you want to start removing all those little dominoes, as many of those you can, and there's thousands of those occurring throughout your day, right? And the more of those dominoes that you can remove, the less likely you're gonna set off that chain reaction with those dominoes that results into a big outcome like an outbreak or like a death occurring. So you kind of got to think about it, all those things combining together, and how they can add up to actually set off a chain reaction like that a set of dominoes, right? So in the next segment, um, you know, I want to talk about those life saving basics. So number of things that I want to go through. These are things I've kind of alluded to it a little bit. So these are things that quietly prevents those tragedies from occurring. So those deaths from occurring, from those outbreaks occurring, and these are things that are not uh, like new, but I want to go through them because these small little things can make a huge difference, right? So the first one that's got a life saving intervention is uh, is hand hygiene. It's one of the things that can have the most impact in preventing transmissions of infectious diseases. So important that you're cleaning, doing your hand sanitizer, to prevent those pathogens from ever reaching someone that's vulnerable, right? So don't forget about that. As a life-saving basic intervention is the hand hygiene, right? And you want to make you know, there's a number of moments throughout your day, before and after you have contact with a patient or resident, you need to be doing your hand hygiene, before exiting a patient or resident room, before you have any, before, after any aseptic procedures, before, uh, after any, um, fluid exposure, bodily fluid exposures. And our fellow talks about again, after any patient contact, after a patient touching the patient's environment or the resident's environment. So all those moments, and globally, it's defined a little bit different. Could be 4 or 5 different moments, but I think most people are aware of what those moments are, so we just can't forget that. And in terms of the anti-hygiene thing, I don't want to forget is gloves. Gloves do not replace the hand hygiene, right? Uh, Gloves are a barrier, sure, but hands are still contaminated during the donning and doffing process. So you always have to make sure that you're doing the hand hygiene. That's why it's built in to the donning and doffing procedures that you do your hand sanitizer, right? Um, most places, it has, you may do when you're donning, because you're putting on clean PPE, PPE that hasn't been used, and sanitizer typically just once. If you do it more than one time, it's fine, no harm. It's the doffing process where you're really going to have to do hand sanitizer a lot more after doffing each piece of PPE. Okay. Next one is, PPE itself. With all those PPE supplies, it's a life-saving intervention. So this is our second life-saving intervention. Talked about the hand hygiene, now I'm talking about the PPE, right? Uh, so you ever talk about, preventing that exposure from occurring and stopping the spread, right? So all those PPE, whether someone's on droplet contact precautions, whether they're on just contact precautions, airborne precautions. So, there's a variety of PPE that goes with it that you need to put on to protect, to protect yourself and to protect the vulnerable resident or patient, right? So, um, and I've talked about, what the type of precautions the person's on is going to define what type of PPE that you put on, right? So if you follow that signage, I'm not going to go through all the different precautions in this episode. I'm just focusing on driving home that message of the life-saving basics. Talked about hand hygiene, I'll talk about PPE, and how that it can have a life-saving, can certainly be considered a life-saving intervention. Okay. The next one is one that I've talked about and previously is environmental cleaning, disinfecting it, and I've dedicated an episode on that. Because it doesn't get and certainly doesn't get enough attention, the impact that it has on a day-to-day basis, right? So the environment in healthcare settings is extremely important. It's a major source of spread of for pathogens. The environment, the railings, anything that the patient's rooms and resident rooms, all those shared spaces that we have in healthcare settings, all the equipment that's shared, all those things need to be disinfected throughout the day, right? And then it can have a life-saving impact as well if it was a life-saving intervention. So, um, and you need to make sure that you're using the right products. So it's not just any product that can be used. You got to be looking at the contact time and know those contact times, and also be prepared to answer questions from uh, anybody that might be asking, like from any administrators or regulators or inspectors. You need to know all about your environmental cleaning and disinfecting, the contact time for the products that you're using and everything. So, and the shared equipment, which you talked about, is a potential source of transmission. I always suggest, that you shouldn't be wiping down the equipment. You don't need to wipe down the shared equipment like a lift, everything, every part of it. You just need to be wiping down those eye contact components that either the staff member is touching or the resident or patient is going to touch when the lift is being used, right? But you need to do it before and after. The reason you need to do it before is because you don't want to assume that the person that used it before you did do it. Also, it could be in a hallway or in a setting where uh, staff and residents or patients could be touching it. So it could get contaminated that way. So that's why it's always a good idea to make sure you use it to wipe it down, those eye touch components of it, either before you use it, and then absolutely make sure you're doing it again after you've used it and you're putting the equipment away. Um, so yeah, it's all those pieces of equipment are potential transmission vehicles, and you want to make sure you're disinfecting it between uses every time. So, um, you know, another life-saving intervention want to say is controlling the source. And I've also, um, you know, dedicated an episode, or to it, but well, the focus this episode on leadership, but make sure that you're staying home, that you're masking when appropriate. So if you begin in the direction by IPAC or public health, be wearing a mask on the floor, or um, wearing a mask, or wearing eye protection. You make sure you're following that protocol. That you're staying home when you're symptomatic, and you're being tested uh, when asked to do so. And not returning to work early. So you shouldn't be returning to work symptomatic. For financial reasons that you need to work a shift, because you have to put it in perspective, the impact that decision can have, right? Sure, it may have some financial impact for you, but you don't want to put that financial impact for yourself above what could result, which could be leading to the death of a patient or a resident. So that's that's the potential tragic outcome that could result from you reporting to work and coming to work when you're symptomatic. So it doesn't matter if you're short staffed. It's management and leadership's responsibility to fill that gap, right? Your responsibility is to stay away and not come to work when you're symptomatic, due to the risk that you put everyone unnecessary risk that you put everyone under by coming to work, right? So we need that life-saving intervention comes that controlling it at the source, like, and preventing not having people coming in when they're symptomatic. And another source control, which I've talked about in previous episode, is people staying home when they're symptomatic. You got to build that culture for them so they feel comfortable staying home when they're sick, right? And that you understand why you're staying home, because you want to protect the most vulnerable people, which is those that are coming into healthcare. So those are staying, like, their home is a long-term care home, or they're a patient, in an acute care hospital environment. So we want to build that culture, and so the staff fuel, becomes two parts to it. That people stay away when they're sick, and if someone comes in when they're symptomatic, you have a culture where people say, like, "What do why are you here today if you're symptomatic? You need to go home. You're putting, all of us at risk, vulnerable residents, patients, as well as your coworkers." So you got to build that into the culture, and that's when you really do. That's when you really move well, way beyond compliance, is when you're focusing on that culture. And when you build that culture that incorporates things like staying at home when you're sick, and not reporting to work until you're symptomatic free for at least 24 hours, and you're building in that within that culture, that mindset and the importance of saving lives, then that's going to make a huge difference. In terms of that life-saving intervention. So, and to move into the quickly to the next segment, the mindset. You need. I've already talked about. You need to move from that compliance to give it more purpose, right? So the compliance can feel more like policing. Do this, don't do that. So we want to change the language and create some ownership, right? Um, you know, and explain to people that by doing all these things, you're protecting the vulnerable residents and patients. You're keeping just enough keeps them alive. It prevents unnecessary suffering. It prevents a tragic event like a death. So you need to kind of reframe some of those common statements that you often hear from when you're focusing on compliance, right? You forgot to do for example, instead of saying, you forgot to do your hand hygiene, say something like, let's clean our hands. and say something like, this is how we prevent transfer to our vulnerable residents. So you're giving much more meaning into why you're doing that, right? So instead of just focusing on like like highlighting what they got wrong, so you forgot to do your hand hygiene, focusing on those things and make it, uh, let's clean our hands. I'll show you, and then explain to them why they're doing it, like why, and getting it back to that life-saving component, right? And not, and not focusing so much, like say you're not following the policy and stuff like that. So, uh, you know, you want to kind of give it, I guess what I'm trying to say, give it more meaning to it. Why are you wearing that PPE, right? What is it doing? It's protecting you. It's protecting you from carrying those pathogens to others. So we got to get, instead of focusing like you're not following the PPE policy, you got to give it a little bit more meaning to it and explain it to the staff. You're using the PPE because, it's preventing you from getting infected yourself. It's also protecting you from spreading those pathogens to others and uh, vulnerable residents and to patients. So there's a number of things, the way you can kind of approach it, I guess, and taking it away from strictly a compliance perspective to give it a more purpose. In this case, I'm talking about by giving it more purpose by focusing on the impact that you're having to the vulnerable residents and patients, and that you're saving lives on a day-to-day basis. So, and I think there's also a message in the next segment I would quickly want to talk about is, the importance of, I mean, you can't delegate that safety culture, right? You gotta build that safety culture, and leaders as an important part of that, right? Leaders help shape that safety culture, right? So you don't want to see leaders cutting corners. Staff learn from that, and they learn that speed matters more than safety. So you don't want to see leaders cutting corners. The staff will start cutting corners. If leaders show up symptomatic, then staff learn that, well, those rules are flexible for some people because, the leadership team or members of the leadership team are coming to work symptomatic. And if they can do it, so, others can do it as well. Um, and so the importance of that leadership method is very important, right? And modeling what you want the frontline staff to do, right? So you don't want many members of the leadership team modeling something that goes against the IPAC protocols, right? Uh, and then there's important role, make sure that for a leadership role that there's enough PPE supplies, they're very easily accessible. There's no barriers from staff accessing the PPE supplies. Leadership role plays role in not making people feel making them feel like the need to like they got to support staff staying home when they're sick, and not giving any guilt or no punishment or with people, you know. So basically, staff need to stay home when they're sick, right? If they really feel sick, you need to stay home, and you need to be able to do that without feeling any guilt, without feeling that there's going to be some punishment that comes from that, from staying home when they're sick, right? So there's a big role for the leadership team there. Um, and from when you do your rounds and stuff, from IPAC staff, you need to approach it that, what can I do today to make things better? How can I fix things? How can I make things run more smoothly for the staff, right? What's how can I make implementing the IPAC measures easier on this unit and floor, right? So you got to be always connecting with the staff, doing your rounds, and seeing how you can improve things, right? Um, and I think if you focus things on like the life-saving lens, that mental checklist, like always think about who you're trying to protect, You're protecting the residents, the patients, the coworkers, you're protecting your family, you're protecting the healthcare system. You got to ask yourself, well, what's the most likely transmission route in this moment? Is it contact, droplet, airborne? Is it unknown what the transmission is? What is the strongest barrier that I can put on you to right now? Includes your hand hygiene, your PPE, your distancing, your disinfecting, the ventilation system, the isolation. So these are all things that play a role in the life-saving component of every shift, right? Um, and where's the riskiest part of your shift? So it's going to come in that doffing, that shared equipment they use when you're rushing transitions, when you have cluttered spaces. So there's a number of things, that you need to think of, like it's a checklist that you're going to go throughout your shift, right? Think about those things that you can do very quickly, like hand hygiene. That's going to reduce risk, right? You're going to be doing hand hygiene a lot throughout your shift. You know, so every task that you're doing, all those moments of and hygiene that you want to keep in mind. You want to make sure you're doing your donning and doffing properly. So all those things, it's got a variety of components, and you want to make sure that you're supporting it. Add the signage for the donning and doffing, so staff know the variety of steps they need to do. And I think, gonna wrap up this episode. You gotta kind of, I guess the best way to word it, you need to re-energize the profession. I guess the best way to say it. You know, pride, pride in infection prevention and control, right? Because sometimes IPAC can feel a bit thankless because the best outcomes are silent, I guess. So you're doing all these things, and sometimes like I said, it doesn't get the recognition that it does until the impact that it has. So part of your role in infection control is to re-energize things on the floor, right? And emphasize the impact that IPAC professionals are having, just like the PSWs, physicians, allied health, the leadership team, the nursing staff, uh, the environmental health staff. We're all playing a role into that uh, outcome of saving lives. So that's what it all comes down to, right? We're all doing it from little different ways, different perspectives, but all those little things we do removes more and more of those dominoes. And by removing more and more of those dominoes, we're less likely to have a transmission occur, and we're less likely to have an outbreak occur, and we're less likely to have a tragic event like a death occur. So it's all about building in and helping people understand their purpose, right? And get that message across. My actions today, my actions reduce harm today, and having that message, staff repeating that over and over and over, and understanding that those actions can save lives. So just kind of to wrap it up, you know, just want to make sure that to take it home that that life saving component is so important, that we want to really emphasize that part of it, and that everything we do throughout a shift, becomes hand hygiene, donning and doffing, everything we do with our outbreak measures, masking, it all makes a difference and can result in, as I mentioned, fewer transmissions occurring, fewer complications occurring, fewer transfers to hospitals, reduced number of people ending up in a hospital, reduced outbreaks occurring in the healthcare settings, reduce likelihood of complications that could result in a death that could be linked to an outbreak or to an infection that was obtained as a result of the outbreak. So uh, really need to treat infection prevention control as a life-saving work, right? And that you can have quite an impact on a day-to-day basis by reducing having fewer infections, fewer hospitalizations, fewer deaths. So Really want to thank you for listening to the Infection Control podcast today. My name is Wayne Tucker, the host for the Infection Prevention Control and Exchange. And I really appreciate you listening today to this episode. Please share it on your social network within a variety of platforms, including LinkedIn. And just remember that everything you do for infection prevention control, you're saving lives every day. Thank you.